Dr. Malone, Joe Zarzaur here for another one of these live COVID updates. We took a little break last week at the end of the week, gave people a break from us. I think they probably enjoyed that. And I think I said we would come back if there was something earth-shattering that happened. Nothing really earth-shattering happened. This past weekend we opened up, pretty much opened up. People just sort of started acting like nothing ever happened. I guess we won't know for a couple of weeks whether that's a smart thing to do or not. But the thing that happened today that I thought people would want some medical information about is the whole vaccine thing. Because if you add to the mix that people are starting to feel better about what they're doing and how the numbers are going nationally, because I know locally there's some differences in how the cases are going down, up, or not. But nationally speaking, I think as a whole, I think the consensus is that the numbers are trailing down. So I guess the question is, from a medical perspective, the vaccine stuff, I know there was only 8 patients that had I forgot what they called it, a reaction to the antibody that was consistent with the amount of exposure, something like that, where they said that the antibodies that were in the 8 people that they gave the virus to produced an equal number or proportional number of antibodies to the amount of virus they were given, which indicates, I guess, that the body was reacting to the vaccine in proportion to, I guess, how our system would normally fight something. I don't know. But anyway, that's why you're here, to explain to us this Moderna vaccination thing that came up today. Can you explain what it is, how it works, and why is it encouraging, and why is it not something we should, bet the farm on, so to speak?
Yeah. So just a real quick review. So the virus is the antigen. That's what causes an infection in anybody who doesn't have any kind of immunity at all or any way to treat it. So that's what we've been dealing with for the last few months. So to say now we have a way to treat it would be if you had a medication to help temper the infection. So that'd be like Tamiflu. The other way is to prepare or to get some immunity to an infection, and that's with the vaccines, which you inject someone with something that causes an antigenic response. So you then create an antibody to your body thinking it's being infected. So there are different ways to trick your body into making the antibody. So you give someone what they call a live attenuated virus, or there's other just particles like the outer surface of the virus that you can inject into people. So that's why there's an array of different studies going on out there to see which one creates the best antibody response. And once you have that antibody, then you're not going to get infected by the real vaccine when it comes along. So that's what we've been trying to do forever with any of the immunizations, but on an annual basis, it's the flu vaccine. So to see someone get an antibody response that is measurable is certainly encouraging. The next step is to see if there's any other safety considerations and different populations you can or can't give this to, depending on what the antigen that's being injected into the individual is. So for instance, there are some populations that can't get any of the live attenuated viruses, like polio used to be the same way, because it would actually give them polio, because they're immunocompromised. So to see what you can apply population-wide, and now you can get an antibody response, is kind of the next step to get this into as many people as possible to on a safe level.
All right.
So that's where we're at.
I know that you're not going to know the ingredients of this vaccination, but it's more than just the virus, right? It's got to be something else, correct?
Yeah. So let's see here. These ones, I don't know exactly. You're right. I don't think that they're disclosing what exactly they're injecting. Right. But so many times it's just components of the virus, some of the genetic material of it. Sometimes it's just the outer coating of the virus, the shell. So that the coronas that we see, those little spikes, they're injecting those and saying, hey, when this attaches to the cells of our body, is that enough to create antibodies? So it could be a combination of both of those. And if it is something that's a live virus, it's not giving someone the actual virus. They're giving someone where there's a part of the virus that's missing, the part that doesn't allow it to replicate, that doesn't allow it to be as pervasive to all the cells of the body. So that's kind of that's why they call it live attenuated viruses, if there is a live component to it.
Now, I know they've sped up some of the FDA process in regards to the approval of the vaccination. Even under the sped up model, though, aren't we looking at many months before this thing is released?
Yeah, so this is the initial round of, I guess, patients, if you will. And so one of the longest steps of the process is usually the human trials. And part of that is the safety monitoring to see, hey, we gave him an injection and created the antibody. That's great. But what did it cause a week down the road? What did it cause 3 months down the road? What did it cause a year down the road? Because there are some other considerations to say, hey, this thing caused the body to inflame as well. And that's when you get things like Guillain-Barré and those other pretty significant illnesses that can be attributable to viruses causing our body to attack itself. So you want to make sure that that's not part of the downstream part of getting a vaccine. Even though you have the antibody, that's great. You're not going to get ill from the vaccine or from the virus, but you're going to have this other bad sequelae, and all of a sudden we have people that are hospitalized because of that. So that's the longest part, and that's the multi-month part. So getting that balancing act, I think, is where we're going to need to be. And so that's why having a number of different manufacturers and biotech companies kind of spearheading this and kind of trying to poke holes in it in every different direction to see which one comes up first. It's a race, really.
So I noticed a couple of things over the weekend. I was downtown a couple of times. I was at the beach some. First of all, downtown seemed crowded, both Friday and Saturday afternoons and evenings. People were congregating on the streets, sidewalks, because the restaurants can only have so many people inside. So the overflow, curbside type crowd, drinking on the sidewalks or eating on the sidewalks tended to be more populated. There wasn't a lot of social distancing happening. What are your thoughts on that? I have also seen plenty of people wearing masks around town, to be honest with you. And so that's encouraging to know that people are paying attention to that stuff. But what is you were out and about this weekend a little bit, I take, is that right?
Yep.
What are your thoughts on going around and being out right now? And would you advise people to pay attention to the social distancing rules, the mask wearing, all that kind of stuff? If they can't be more than 6 feet away from most people, should they be wearing them?
Yeah, I would encourage still maintaining. Every time I leave the house, I got a little bottle of rubbing alcohol or the hand sanitizer in my pocket, and before I get back in my car, I'm making sure I'm wiping my hands down before I touch anything in my car, depending where I've been. So I've got that, and I keep a mask in the car in case if I end up at a place where, like you said, I can't reliably distance myself. So you had mentioned that we went out to the nursery this weekend, and we were outside the whole time. I wasn't around anybody, so I didn't have a mask on, but I had my hand sanitizer. So made it through the little checkout aisle and went right to the car, and first stop was hand sanitizer.
Okay, well, that was good. So what about restaurants? I know that they rose the limit. They made the limit 50% now instead of 25%, and I think the fitness centers can open with some restrictions. What are your thoughts on that?
My thoughts on going to restaurants is, personally, I would prefer sitting outdoors if I had an opportunity. I think I'm still a little bit leery about being indoors. I know that it's 50% of like their whatever the fire marshal capacity is, so it's probably a little bit of an inflated number. So I don't know how the different restaurants are using that math to their benefit, to get more customers. But anyhow, I would prefer sitting outdoors for any of these places that are allowing for that. I ate at a restaurant, I guess 2 weeks ago now for Mother's Day, and I felt completely safe. And we were outdoors, and felt bad for the staff that was working there. But every time they came to the table, it was kind of like shouting to order. But hey, it worked. And so we were at a table that was meant for 8.
There's a video circulating on the internet, and what they did was one of the people at this dinner function had some kind of infrared dye on his hand. And it was either they had an open bar or a buffet. I can't remember because I wasn't paying close attention. But what they did was they filmed this whole thing. The guy that had the infrared ink or whatever on his hand, of course, went through the line at the bar, the common buffet or whatever it was. And at the end of the, I guess, 2 hour or whatever, they did I guess they introduced something to the film that allowed the infrared ink that was on the guy's hand that you couldn't see with the naked eye to show up at the end of the film. And everybody had it on them. Like everybody in the whole room at all these different tables all had this stuff. Some had it on their face, some had it on their hands. And I thought it was a really good example of how this stuff travels from one person's hands. If you're using common things, it's going to be all over the place. And so, this was a test and they were trying to prove a point, right? So you don't know all the biases that were built into that experiment, but it did drive something home for me. And that is, if you're going somewhere where multiple people are going to be using the same devices or things, utensils in this circumstance. If you're at a bar, the bartender is going to be touching a lot of things like bottles and glasses. And if the bartender has this on their hands, everybody in the bar is going to have this problem, right? So, but then it has to get to their face, right? So if you're keeping good hygiene, even if your drink has something on it, and let's say you don't transfer it to one of your cups and you drink out of the cup that the bartender gave you or the bottle the bartender gave you, if you assume that drink is tainted or has whatever on it, as long as you don't touch your face before washing your hands, you should restrict the virus from spreading from that object to your body, right?
Yeah, and so that's what you're laying that all out. So two things came to mind. One is I personally don't plan on ever going to like a buffet in the near future. Like that's just I'm not going to be in that situation. But number two is our skin is also covered with a bunch of bacteria. That's just the way we are. That's the way we're built. Right. And we don't get infected when we shake people's hands. So so to make contact with someone is one thing, but then to what you do with after you made that contact is where the infection is taking advantage of us. So touching your face or touching something that's going to go in your mouth, like a fork or a spoon or a cup. So, I'm always putting the hand sanitizer on. Like my wife was like laughing at me because we got a shipment at the house the other day, and she's like, "You bought more hand sanitizer?" I'm like, "Yeah, because I'm going through it, and I'm at the house."
Right.
So,
all right. So tell us where our numbers are, because we've been keeping track. This is our 10th week working virtually. We have a couple more members of the staff here, but everybody's spread out. Nobody's anywhere near anybody else. We're all wearing masks in common areas. But where are we number-wise in the 10th week of virtual working here at Zarzaur Law?
Okay, so in the county, we have 700 cumulative cases in the county since, I guess this all started probably 10 or 12 weeks ago, whenever they started keeping track. I think about 12 weeks ago is when it was the first case. So we're at 700 cases cumulative. Of those 700, 20 people have died that are related to it. And of those 20, 15 were from long-term care facilities in the county here.
Wow.
So, I mean, there's good news and bad news depending on which way you look at that. I mean, the good news is that for the vast majority of people who are getting infected, they're not dying from it, at least in our county. And you would assume that they're recovering from it. To feel puny or bad as it impacted them, maybe. The downside is, hey, once it gets into these nursing facilities, long-term care facilities, that's the at-risk. We've been saying that for many of the last 10 weeks. That's the at-risk population. So that's the good and the bad there.
Yeah.
Go ahead.
Is somebody's contact tracing here locally for positive cases once they get diagnosed, or is that not something that's happening locally?
I hadn't seen anything like that, with the exception of the long-term care facilities when the National Guard was brought in probably about 4 or 5 weeks ago in that testing. I think there was contact tracing as part of that from something I remember reading, but I haven't seen any real contact tracing, at least in any of the news. And I know at the outset that certainly wasn't going on, but I'd like to think now, because the cases per day that are coming in positive isn't nearly what it was before. And I don't know if it's a factor of the infections under control, or people have just kind of grown weary of like, I'm not going to go get tested kind of stuff. And I got tested already. I was negative, so I want to go back. So it may be a confounded number. But anyhow, I think with a more manageable amount of cases coming in positive, I think there'd probably be more contact tracing going on. At least I would do my own version, if I can tell you that. So.
Right. And then you had a test last week, right?
Yeah. So I got the antibody test last week. My wife and I both did. And we were both negative. It was the LabCorp test. We were dead set that, we were more acutely ill than we'd been in years. And this was back in February. And we kind of looked back and said, wow, maybe we had the infection. So we got the antibody test, and it was real easy to do. And LabCorp's got a policy where they're not billing any uncovered expenses to the patient. So we didn't realize anything but the $10 registration fee to get to the test. Everything else is either picked up by insurance, and what insurance can pick up is basically being dissolved. So if you think you're exposed, I mean, I think right now, if I had a positive test last week, I'd be living a little bit different now, meaning I wouldn't be worried about exposing myself as much. I would be worried about perhaps being a vector where I can still pass it to someone. Yeah. But look into that if it's available to you.
So you got home and ordered more hand sanitizer. You're like, all right, well, got the results. You got to get on Amazon and get some more hand sanitizer.
Yep. Oh yeah. So did that. Trying to think what else we had on here. So the long-term care facilities locally, as of the most recent update, we're not the highest in the state anymore. Some of the other counties, like in South Florida, are picking up where we were. But we have, we have 34 at Asbury Place, 22 at Southern Oaks, and 11 at Rosewood, as far as the three big ones in the county here. So not a whole lot of change there. And that's for the current infections. All the other numbers I told you are cumulative infections. So these are current. So it just goes to show you that if you have any reason to do anything at all at a long-term care facility, that would be as controlled as possible, but try to avoid it or have your loved ones avoid it.
Right. Okay, very good. Briefly, run out of time, but I wanted to make sure that we covered this. The other thing that came up last week was the outbreak in New York, or the discovery rather in New York, that children were coming down with something similar to Kawasaki disease, right, if I'm saying that correctly. Symptoms were, I think, swollen hands and feet, high fever for several days, rash. What are the other symptoms, Evan?
They get like a strawberry tongue, or a real red looking tongue. They just got like red candy or something like that. That's what it looks like.
And many of the kids were going undiagnosed for some period of time, because everybody thought that, oh, this can't be COVID because kids can't get COVID, so this must not be COVID. And it turns out it was COVID that caused them to have these symptoms. And a lot of them got critical because it was allowed to progress or regress for such a long period of time.
Yeah, and so like you said, the thought was, oh, the kids couldn't get the infection. But the other thing is, kids are always dealing with like sniffles and sneezes and all that. So it's kind of like, okay, they're gonna develop an immunity to whatever they just got infected with, some other virus. They're gonna bounce right back. But this is one that if they get behind the 8 ball, like with hydration and stuff, these kids are showing up and they're dehydrated. They're in renal failure. They're liters behind of fluid, which doesn't take a lot on a kid when you're talking about something that it's 20 or 30 kilograms. That's real easy to get dehydrated when that's your body mass. So that's why their tipping point is a lot more narrow than an adult human being.
All right. I'm going to try to find the link to that video I was talking about that shows how easy it is to transmit stuff. We'll come back if there's something earth-shattering that comes down the pipe this week. We did want to just pass on this information to you. If you have questions for Dr. Malone about the COVID, you can find us on the web at zarzaurlaw.com. If you have questions about a personal injury case, medical malpractice, a car wreck, there has been a major uptick in car wrecks, by the way, folks. People are out on the roads and everybody's like happy to be out and they're letting it all hang out. I'm sorry that that's resulting in wrecks and injuries, but it is. You can find us on the web at zarzaurlaw.com. You can call us the old-fashioned way at 855-HIRE-JOE. Dr. Malone, thanks very much for being with us. And we'll see y'all back next time. Thank you.
Thank you.